wait for disaster to strike. This hurricane season, be ready. Protect your home with an affordable and comprehensive home insurance policy from Shield Insurance. You can't control what nature blows your way, but with Shield Insurance, you can rest easy as you ride out the storm. Protect your largest and most valuable investment. Don't take a chance. Put your home in our hands.
Shield Insurance agents and brokers in Nassau, call 356-7202 or Freeport 352-5945.
The views and opinions of the host and guests are their own and do not necessarily reflect the position of the management and staff of Guardian Network.
You have to be strong in today's world. Keep your focus and what you believe in, how to achieve all your dreams. Keep moving forward, never accept less than who you are. Live your best life. Be strong and free.
We're back with Nahaja Black is sponsored by the Cancer Treatment Centers of America, BTC, J.S. Johnson, and Baja Retreat and Spa.
It's a hit back with Nahaja Black. It's a hit back with Nahaja Black.
Good afternoon,
Beulah Gal. Can you believe this?
Welcome to the Hit Back with Nahaja Black. I'm your host, live in studio today. Hope that everybody's doing well, taking care of yourself. We got a big show for you, of course. Special shout out to my wonderful producer, April, who's doing all the wonderful things in the back there. She ain't noticed was trying to cause mischief, but it ain't working. Special hello also to my producer, Kermie. Hope everybody's good, taking care of yourself. The Prime Minister had a speech last night. Was it a speech? It was an address. So the Prime Minister did his address last night. It was definitely interesting, to say the least, that the Prime Minister's address happened. And so I don't know what many thought about the address. I don't know how you felt about it. Was it good for you? Did it do what you needed it to do? Did you get the answers that you needed? So we have a good show for you today. We got a show that I think is robust in terms of what we're going to cover. One of the things that I've wanted to do since this show, this pandemic has started, is speak with folks on air. And hello to my good friend Maria and everyone else who's online watching, to everybody's listening, 96.9 FM. Folks who have found themselves challenged with COVID-19. And so I've got joining me very soon, he'll be logging on with us, is the QC himself, Wayne Munroe. As you all know, Wayne Munroe found himself hospitalized due to COVID. And we're hoping we've been praying for a speedy recovery for him. And he's now home. So that's great news. My doctor, our good doctor on the show, the one and only Dr. Susan Williams Lockhart, is still in the hospital as she was fighting COVID as well. So, you know, it has been a challenging time for sure, and wanting everyone to just stay safe. So when Wayne logs on, it's going to be quite an interesting conversation. Also joining us in studio will be the Shadow Minister for Health, Mr. Dr. Darville, Michael Darville, will be joining us in studio. And the reason why, and I reached out to him, the reason why I reached out to Mr. Darville for him to join in studio is that one of the things that we've been hearing is, okay, well, you know, the Prime Minister isn't doing X, Y, and Z. This is not happening, blah, blah, blah. And it's time for us to hear what the opposition, and I'm sure I've heard some snippets of what their plans have been or what they're hoping to do. But it's good now that we'll get it on the show. What is the opposition? The leading opposition, the only opposition in the House of Assembly. What are their plans to combat COVID-19? What would they do differently? So that's what is going to be interesting with that conversation. So that'll be happening at 5:00. So as we wait for my guest, Wayne Munroe, and we just spoke, so I'm just waiting on him at any moment. The question goes back to, what did we expect, right? What did we expect from the speech last night from the Prime Minister? The concern, or what I came away with, was one, that it was something that I believe that it could have been, I don't know, now I wonder now, it wasn't as sermon-y as the last one. It wasn't a big sermonette. As usual with many of these speeches, we tend to take a belabored approach to the point. What is the point of the speech? Do we feel good with what was shared and said? Do you feel as if you're more confident? Do you feel, a lot of people said that they felt more assured. There's more vaccines that are coming in country. Everything coming, it coming, right? So there'll be more of those things coming in country. And so that matters for a lot of reasons, those things that are coming but not yet here. Did you think that it was just filled with fluff? Were we looking for more solutions than we got in real life? I don't think that we walked away with some concrete solutions other than vaccines are the answer. And listen, I still do believe that we need to get vaccinated to a certain degree, but I do understand people's concern with it. And if we are not making it mandatory, which the Prime Minister stressed, we are not making it mandatory, then, ladies and gentlemen, for that reason alone, we should be giving other alternatives or other major plans or directives. One of the things is, how do we now use data to help us control the spread? Is that possible? Considering we're a small nation, small nation with a lot of landmass, the ability, I believe, to quarantine folks is very much a viable possibility. Have we looked into that? Have we looked into the cost of that? What does it mean to quarantine folks who have come up positive? Should we do free testing so that we don't miss people who go under the radar? So if one person is in the house positive, that confirms to everyone else. Everyone else probably in this space is positive as well. So that proves to be the challenge there. So I think that there's a lot of concerns on how this will all work out, right? But the vaccination is the main arm, right? It's not the main arm of solutions. So that is where it's going to be a challenge for the Prime Minister. If we're not making it mandatory, which he's promised he won't, and I believed him, I do believe that he will not make it mandatory. There's been that restriction, the reduction of time, they're tightening the noose a bit with the times, the hours that you're out and about. I listened to, I think, Dr. Dwayne Sands, he was last night, where I think he was asked the question of the time, right? And he says, well, it matters. It works, right? It does. Oh, right. Last night, I watched him last night post the Prime Minister's speech on Clint's show. So, he says it works. We'll see. Again, needing the data for how these things work. Can data help solve the problem? Can more information help us? Free testing is important. I really do believe that that's something that can help us if we test more. Less people will be in the house positive without us knowing. Can we really quarantine folks, man? Can we quarantine those who are positive? Get them healthy whilst the rest of us move about, so we're not increasing the spread. There has to be more than the one thing, which is vaccinations. If you're not making it mandatory, then you need to give us some other options, some other solutions, other remedies. I think that would go a long way too. If we had our own body that's going through this and I'm hearing people ask, well, what is in it? Just for the record, I'm happy that folks are now very interested in what is in their products that they're injecting into their body. I'm very happy, but I want to make sure that we're aware too that you've gotten probably all of your other vaccines. Were you concerned what was in them at that point? Were you concerned then? I'm happy that we are concerned now. We should always be concerned. But I'm curious as to, are we asking what's in the measles, the MMR vaccine? Are we asking what's in the tetanus shot? Are we asking those questions? If not, then ask yourself where all of this is coming from. Where is this coming from? if you trusted folks before, you don't trust folks now. Who will you trust now when it comes to this thing called the vaccine? I'm not going into debate on whether you should take it or not. Just curious as to how come we don't trust our doctors all of a sudden when we trusted our doctors before, right? So if you trust your doctor before, then go to your healthcare professional and ask them if that is something that you should take. Just go ahead, ask them if it's something that you should take, then take it. But if you don't want to take it and if your physician says it's not for you, then it's not for you. But I've actually, one of those concerns for me is now folks saying, oh, well, I don't even trust doctors. And when did we get to the place where we're not trusting doctors? What do doctors do to us? You know what? We move from having lawyers as prime ministers to a doctor as a prime minister. All of this could affect how we trust people now. If we move to having an accountant as a prime minister, will we not trust accountants as well? I think it's going to be, that's a weird one. Still here waiting to see, I again sent it to Wayne Munroe, waiting on him to click on it for me via email. So we will be having today, and messaging him again. I just saw him respond. So what we're having again today, the show is Wayne Munroe QC joining us in a moment to give us a heads up on what that process has been like for him, COVID-19, finding himself in the hospital due to COVID. And then we also will be joined by Shadow Minister of the Free National Movement. You can feel free to text us on 422-4796. That's 422-4796. Someone says, are we asking the credentials of pilots on planes we fly on? No, we don't. We don't ask the credentials, right? Joining us now, and I see my guest here, joining us online now and ready to go. I'm happy that he's sitting upright. I will see if he looks well shaved. He didn't shave before. Maybe they made him to shave after. But joining us right now is good friend Wayne Munroe. Wayne, welcome to the show, buddy.
Thank you, Nahaja, and I have not shaved.
It's good to see you. You look nice, and it's upright. How are you feeling? Tell me a bit about yourself. How are you doing?
I'm doing all right. It's been an experience. Somebody, my doctor happens to be a priest. So if you don't listen to him, he could give you last rites, If you don't do what he tells you to do, then you'll see him when he comes to give you last rites. And so he has quite a persuasive way of telling you what he thinks you should do. And you will either do what he tells you he thinks you should do, or if you don't do what he tells you he thinks you should do, then you'll see him again when he comes to give you last rites.
Oh, well, we don't want last rites so early. Wayne Munroe QC joining us on the show here, the hit back with Nahaja Black, Guardian Radio 96.9 FM. You can also watch us live on YouTube or on Facebook as well. Subscribe to our YouTube channel and our Facebook channel. Search Nahaja Black. You can also listen to us live on the Guardian Radio app. All right, Wayne. So, it's good to see you. I think all of us, a lot of people were very concerned. You might have had some haters there too, but the majority of Bahamians were very concerned about the news that you were admitted to the hospital. And it was so crazy because, of course, I think just a few days prior, you were on the show and, chatting with the public. You're always on with Rodney. So there was always that people are always hearing from you and seeing you. And then we get the news. Everyone is curious. How did it get to that point? When did you know you were sick? And what made you decide to pull the trigger to go to the hospital?
Well, the really funny thing is the last time we spoke about the government letting people in here vaccinated without any tests. Mm-hmm. And I did say, almost prophesied that would bring the Delta variant here, if it hadn't already brought it here, and it will make some of us sick. Mm-hmm. And lo and behold, now I didn't feel sick, I felt tired. Mm-hmm. And as I say, Father Roland Hamilton is my priest and doctor. And so the wife called him. He asked me to go take antigen test. I did. It was negative. And so I also took a PCR test at the same time. And then he came over with his oxygen meter. he wasn't pleased with the oxygen level recorded. He told them to get some oxygen for me. And then from there, he started to communicate with them. And towards the end of the evening, not liking what he saw, he told them to take me to hospital.
So, and I have to go back to the beginning. Why did you bring up that? Lo and behold, I'm curious. You brought up the fact that, you said that the variant would come in country and it would make people sick. Were you exposed to someone who came in country? Is that why you brought that up?
This is the thing, you don't know. And
I just thought it was a great spin that you pulled the prime minister.
But this is why you have to be so careful. Mm-hmm. And why we were saying that you had to be careful from they started the nonsense with the health, the local porting, that you have to test everybody because you don't know. So you have somebody jump off a plane, you have somebody jump off a boat. They talk to Jim Brown. Jim Brown talked to Susie Black, that spins rounds and round in your community. And Wayne Munroe may buck into them one day, and there you have it. So this slackness that they were practicing and having people come here, not testing, when everyone else tested everybody who came in, was something I spoke about right on your show before I was admitted to hospital, because it was just so obvious.
But when we spoke on the show, you sounded normal. You sounded good. So, I mean, was it something where you started to have, what was it, trouble breathing, coughing? I mean, give folks an idea for those.
I was feeling tired. Father Hamilton, he's a doctor. He's my priest. He's my friend. So he came and he measured my oxygen level and he said, look, I don't like this. And it went from there.
Really? So,
I've never had problems breathing. Since I've left hospital, it was coughing I have done. But what he saw in his oxygen readings, he arrived at a medical conclusion.
Wow. Now that's even more interesting to me too, because if you're just tuning in, Wayne Munroe QC joining us on the show, because if you just felt tired and you called, and I gather you called because you were tired, was it your family? I figure your family may have decided it was time for you to behave, and your wife probably called for you. That's probably
how you know that?
That's what it was. I'm sure it was your wife, because you're saying all it was that you were feeling a bit tired, and then we have the father come in. So I'm sure now that someone had to call because you were just thinking you're tired. So it was.
No, she called. He made it plain. She called him. He's coming to do this, whether I like it or not. Blah blah blah. That's just the way it goes. It's fairly good to have a priest who is a doctor, you know.
Yes, it's very good. Last rites or medical advice. I'm with you on that one.
Those are your two choices.
So then, of course,
so he came for me.
Mm-hmm.
As I said, I personally never had problems breathing. When they told me to go to hospital, I was a little bit annoyed because it was in the night. But then, my two sons turn up and there's workout, so ain't no point arguing with them when they say, let's go. So I said, okay, let's go.
Your two sons intimidated you, and then you went to the hospital and were admitted. Period. And
so I could have taken them eventually, but what's the point?
No. Your oxygen levels were low, Wayne. You couldn't take anyone in one lung. You better stop. So then let's go to this now, because the same time you were admitted, literally, Wayne Munroe, I think you and Dr. Lockhart were days apart, right? Only days apart between being on my show last week, I think it was. And right after I got the announcement of you and reaching out to you, literally maybe about an hour later, I got the message from Dr. Lockhart's husband that she was also in the hospital due to COVID. Both of you now in Doctor's Hospital. Both of you have my concern up, right? And Doc, of course, was there for my family when we needed it, right? So let me ask you this. She's giving me her account of the process, the account of her process at doctors. And the service, of course, is fine. Everything is good. You pay for it. You guys are doing well. Y'all got the money. Y'all can afford. Insurance showed up. Thank you, Jesus.
I didn't have insurance. I don't have health insurance.
Well, I mean, you're good for it. So we're not gonna. I'm sure your bill will be paid. You're all right. So what was that like, the check-in, when we hear doctors' hospitals saying, listen, this place is overcrowded, we're running over? What was your experience as a COVID patient?
I was checked in. They took me for a CT scan of my lungs. And then they took me to a room, which wasn't a patient room. All the while I was in a room, I think they call it wound care. Had no bathroom. They're literally so busy that they're just trying to find places to put people. And so you are fortunate to be in hospital, so you don't complain that, you know, you have to go back to cowboy, and I'm an island boy, so that doesn't bother me much. And that, you know, you just don't have the amenities, but it is what it is. And then, of course, when my sister from the US was asking, do I want to be airlifted to her, I tell, of course, no. Because Dr. Kevin Moss, who was the doctor assigned, I know him. He knows what he's doing. There's no reason for me not to suspect that he's going to give me excellent treatment. And so I had all confidence in the medical professionals, and they did a fabulous job.
The process of care and health, you mentioned that, you know, you've seen it. It was overwhelming. There was no private room anymore.
No, the room I was in, it was just me because nobody else could get in there. But the process went like this. I had a CT scan, and they come and they're quite blunt with you, you know. They tell you the scan goes from 0 to 25. 0 is good, 25 is dead. That you're at 12, 13. So you're probably gonna miss intubation and that sort of thing. But no doubt, if you were at 20, 21, they would have given you grim news. So it is what it is. Once you assess, they give you their best judgment. Then they tell you what their treatment of you will be. And then once, because you have to say yes, once you say yes, then they begin treating you. And I must say that there's some very interesting people, the nurses and the doctors. That's the first time people could wake you up without waking you up.
Say it again. What do you mean people could wake you up without waking you up? Explain.
They take your vitals at all times of the day, right? And you're sleeping, and you know they came in, and you know somebody woke you up and took your vitals, but in a minute you're back to sleep, and you don't really remember anybody coming in and taking your vitals or doing anything. So they developed quite a trick at doing it.
In terms of your treatment, and did you feel yourself getting progressively worse, then better? What was that process of knowing you were doing better?
Well, they basically put me on oxygen, and I slept for 3-4 days.
Just sleeping, really? So go ahead.
Sleeping, getting up, eating, using the restroom, which was quite nice because there was a jug. You didn't have to go far. And eating, and then going back to sleep.
All right. So this COVID for you, even though you ended up in the hospital, I don't know if you're downplaying it or whatnot, but COVID for you was not a big deal. That's how it's coming across the way you're saying it, Wayne. It wasn't as...
But there's nothing for you to do. They come and they give you, they were treating me, I think, with remdesivir and steroids and some stuff to stop you getting your stomach from giving you problems. And they would, and they put a IV line in my hand, and they would give you the drugs. There was nothing for you to do than take the drugs and wait for them to work.
And your oxygen levels?
I wasn't in pain. I wasn't in pain. I imagine even if there had been an issue of pain, they would have given you something for it. They may well have included something in the IV for pain. I didn't experience pain during my stay there. They had me on oxygen for all, but I think the last 2 days, they reduced it. Sometimes the nasal thing came out, sometimes it didn't. But it literally is just laying there, receiving the medication they have for you, and sleeping in the meantime.
And the remdesivir, I was told, and I know it works. It does work. The medication that they are using, I also know that PMH uses it as well. So it's a wonder drug right now on helping patients in there. But I gather that if you're past a certain point, then you need more than just remdesivir. With your
they tell you that. They tell you there's a scale.
Yeah.
And the CT from 0 to 25. If you're past 20, I think that means you're likely to end up intubated or some such things.
When you were in there, did any of the doctors or nurses give you an idea of what level many patients who come to the hospital find themselves at? Like you were saying, you were between 12 and 13 on the scale. When do a lot of patients, were you informed of when folks end up or tend to show up to the hospital? Do you consider yourself lucky that your family, your wife, your priest, they were able to give you that directive when they did?
Well, they didn't talk to me about other people's medical circumstances. The most that he did say was give me an idea where I was on their scale and where the different spots on their scales are. As I say, I didn't go in for any breathing difficulties, any particular pain. I read in because my doctor priest was being proactive, I suppose. So I'm grateful, but that's how it went.
Yeah. And we're going to take a quick break. When we come back, then Wayne, also, I want to ask about, the testing of, I guess, the rest of your family and how were they doing? And then what were the key takeaways that you got from this process? Now, as someone who has, of course, had COVID-19, found yourself in hospital, what were some of the things that you walked away with as key takeaways after we come back from the break? You're listening to the Hit Back with Nahaja Black. Wayne Munroe, QC, joining us at home, 24, almost 48 hours out of the hospital, joining us on the show. We will be back right after this.
Beulah, gal, can you believe this? We are now the patrol queens of the neighborhood.
We now large and in charge. So we need to check out what's going on in everybody's yard. What about that gun that we know that Junior and his homeboys just ran out? Can we report that too?
Of course we can.
But we could be in deep trouble if they find out.
We need to report what we see, Beulah. When you call Crime Stoppers, they just answer your call in Miami.
So then we can report everything? Guns, where they hiding the drugs, who shoot who part of which gang, or who disturbing the peace with the loud music and the motorcycles.
Then our neighborhood will be the best in the Bahamas, and everybody gonna want to come live here. And then our house price will go up, gal.
So what we waiting on? What's the number?
If you see something, say something. Let us all pitch in and stop the crime before it's your time. Call 328-8477 from Nassau or 242-300-8477 from the Family Islands, or text us through the Crack Crime Bahamas app. Stop the crime before it's your time.
Enjoy an elevated mobile experience with BTC, giving you
unlimited talk for the best conversations, unlimited data for all your online fun,
and unlimited roaming to stay connected while overseas.
For just $50 per line.
Unlock unlimited mobile talk, data, and roaming when you sign up for BTC Superfast Fiber Internet with speed starting at 100 megabits per second. Enjoy more great savings and value. Upgrade or sign up today. Visit any BTC store or BTCBahamas.com. Conditions apply.
Rejuvenate, refresh, treat yourself. Immerse yourself in total comfort. Pamper yourself. After all, you're worth it. Relax. Rid yourself of all life stresses. At Baja Retreat Anti-Aging Spa, you will find everything you need to enhance your body and spirit. Call today at 323-6711 and begin your journey to serenity at Baja Retreat Anti-Aging Spa.
This is Guardian Radio 96.9 FM, Nassau, Bahamas.
It's the Hit Back. Hit Back with Naja Black.
And we're back. You're listening to the Hit Back with Naja Black, our good friend of the show, Wayne Munroe QC, joining us, telling us a bit about his experience as a COVID-19 patient, not just having COVID-19, but now having to do a hospital stay because of COVID-19. Wayne, let me ask you, what were some of the key takeaways? What were some of the things that you learned? And we lost you on camera, Wayne. I don't know what happened just now. So we lost visual. Are you still there? Are we still, did we lose? Yep. I think we may have lost Wayne. Hopefully we'll get him right back on the link. And I think one of the things that makes this interesting is that in all of this, you know, one of the questions that is going to be asked, and one of the questions that I'm going to have to ask as well, is, do we believe that, does he believe that lockdowns work? Where's his stance on, and I see him, he's back. Let's see if we get you back. There you are, Wayne. Good to have you back, buddy. So key takeaway for you. What were some of the things that you learned in this process?
Well, they were things that we always knew, which is you will not know when you're infected with COVID. You will not know who will infect you with COVID. One of the odd things is after I was infected and everybody tested, everyone in my house is fully vaccinated other than me. And my fully vaccinated daughter was infected. So you have earlier than I was by all accounts. So you're never going to know who infects you. You're never going to know when it happens. And the best that you can do is seek to keep your immune health up. Persons like me who run and run our bodies down, we do ourselves a disservice. So that's my first takeaway from it. That it's very important not to run yourself into the ground because you don't know when you're going to come into infection, and you do not know when it's going to happen. And so your best chances are to have the best immune health possible. And that's the bottom line to it. And let me say this, Nahaj, I have people running on with, there's mandatory vaccination. We could shut up about that for now, you know, because until we get 600,000 vaccines, it's really not an issue, is it?
Good point.
So
good point.
I really don't understand why people keep running on with this nonsense when they tell us we need 70% coverage. 70% coverage would mean we need about 600,000 doses of vaccines, and we don't have it. And so it's an artificial question that the leaders who have failed to produce these vaccines, and that's what is very troubling, they have failed to produce even 400,000 vaccines. And they're creating a false argument about vaccination when the real argument is, buddy, you don't seem to be able to get vaccines. So,
but I mean, even in the idea of the, you know, and I agree with you. Listen, we don't have vaccines right now. So of course, and great point, you can't make anything mandatory even if you wanted to, because we don't have any to force anyone to take anyway. But I wonder with your stance, and I read in the paper, Wayne Munroe QC joining us, I read in the paper that your stance on vaccinations has not changed through all of this. And go there with me, please. Has your stance on vaccination changed at all?
No, it has always been my personal belief that I don't take any vaccination. I don't take any drug that nobody takes responsibility for. If you were to take a smallpox drug, if you take a smallpox vaccine and something were to happen to you, there's a limited coverage in their vaccine coverage for it. And smallpox is actually long-term approved. You don't have that limited coverage for these vaccines that are not long-term approved, that people are insisting to us are very safe, very, very safe, but nobody wants to take responsibility for. I have a fundamental problem with that. And that is my fundamental problem. Dr. Cy Pierre wrote a letter the other day to say, wait a minute, Nobody has had any children who have been vaccinated with these vaccines. Do we know what's going to happen, how that's going to look?
Mm-hmm.
And so what frightens me is when people tell me something is absolutely safe, but then insist that they won't take any responsibility for it.
Won't be a guarantee for it.
But not even a guarantee. Will take no responsibility for it. Not even the limited responsibility they took for the existing vaccines.
So now here we are. And, I think that there is a big statement of fact that I think you really, if you're someone who just looks at, the viability of it, that's a great argument. It's a great argument. I think it's a great argument.
All it takes the Bahamas government to say, look, Munroe, we take responsibility. We will take responsibility.
But they're not even close to that. That's not happening. We've seen that. That's not happening.
Back in February, I think it was, Dr. Darville just said that they were considering whether they would take responsibility. But I'm saying to them, if they're going to be morally honest and decent, that they should say to the Bahamian people, we're telling you this is safe, and so we will take responsibility for it. We, the Bahamas government, we are telling you this is safe. We will take responsibility for it. And if they continue to refuse to do it, the press needs to be a lot harsher in asking them why. Why, if you're sure this is safe, are you not taking responsibility for it?
Wayne Munroe, QC, joining us on the show. So now, at this point, Wayne, and I know you heard I don't know if you heard. I figure you shouldn't be listening to anything anyway, and you should be convalescing and not running yourself further into the ground. And I hope that you got permission from your family bosses to even do the show. But you're done here, and so you take that up with your children and your wife later. That's a later grievance.
Yeah.
But last night, of course, there was another address, right? Another address. Today, there's an extension of the orders, the emergency orders, and a promise that there will be no more after November 13th, and that we're going through this process of an emergency preparedness bill that should have actually been done before they went to recess in the first place, right? Needed all of these weeks of recess. It was something that should have been done before you went to recess, but I digress. Your thoughts on it as someone now who's gone through the process of COVID-19, been in the hospital, seen the state of healthcare from a private side, from the private medical side. What were your thoughts on it? Was that what you were looking to hear?
Well, I'm not finished with the government yet, because the doctors and nurses who treated me in Doctors Hospital also work in the public institution as well. And I really would wish the Prime Minister and Renwood Wells just shut up until they pay the people the money they owe them. They owe nurses, they owe doctors. They've been bragging on these people. These are the people who are actually saving lives. These are the people who come to my room in the night. These are the people who see after my welfare. These are the people who see after the welfare of the people in the public hospitals. It is really distasteful that you have two men who call themselves Christians, who like to talk about the Bible, who have these workmen waiting for their wages. I really wish they would shut up until they pay these people their money, because they've earned it. I've witnessed it. They've earned it. Pay them. Plain and simple. The doctors shouldn't be negotiating for monies they've earned. The nurses shouldn't be negotiating for monies they've earned. It is unchristian not to pay people you owe. Let the Prime Minister look for that to be the next Bible lesson he teaches us when he speaks again.
Wayne Munroe, QC, said the next Bible lesson, if you go, what's that? Pay me what you owe me.
A workman should not be made to wait for his wages. But to the question you asked, it was always the case that the emergency orders were going to be extended. I think I said that on your show as well. It wasn't possible that they would just come to an end. Now, I've received a copy of the public health Emergency Preparedness and Management Bill.
Mm-hmm.
And I'll be having a look at it. I've committed to the Attorney General to give him my views directly. And of course, I'll give the leader of my party, Philip Brave Davis, QCMP, my views directly as well.
Mm-hmm. You know,
whether they can do it like that, will be something that I'll give them my honest opinion on.
Here's where we are now, Wayne. This is where I think it's quite interesting to me. Now we're here. And I think the reality, everyone in the Bahamas now is to a point. And someone was saying, you know, you don't sound as strong, and they're praying for you, and glad to see you. So that's a lot of the comments people are saying. We're glad to see you up and about, glad to hear you, that you're doing well. Someone says you don't sound that great, Wayne. So, I mean, you're downplaying how serious this was because you don't sound that great. Yes, for the record, you don't sound like you see pre-show.
It's difficult to hear how you sound to other people.
Yeah.
But if people say I am not at my full voice, I'll have to accept that.
You know, the process of taking oxygen, were you ever in fear of, once you walked in, and I think that's something that I've never heard before. And I have to say that you taught me something in this process because I hadn't heard of the scale, right? Having family members who'd gone through it, they never mentioned being told about a scale, right? I thought that was interesting. Did that help to assuage some of your concerns, that scale, knowing where you landed?
No, so I would tell you, and people think I joke when I say it, every day that I wake up, I am prepared to die. I don't particularly want to die that day, but I'm prepared to die. And whenever you receive news from a medical professional, it can be everything from very good news to very bad news. And so as far as that is concerned, when you go in, they tell you what their assessment is. Now, knowing the nature of the disease, the reality is that you will either be treated in the ordinary way with the steroids and the drugs, and if things get very bad, you may have to be intubated, and if things get very bad, you may have to be put in a coma, and if things get very bad, you could die. That's the reality of it, and we will all die one day in any event. And so when I went in with that as the reality of what I understand to be how the disease operated.
Someone sent a text, said, my family members never heard of the scale because the regular patient doesn't get a CT scan of their chest. And I wonder, right? I wonder, let me ask you this, Wayne. And of course, you can't compare it, right? You can't compare it. Something that Dr. Lockhart shared with me that I thought was very, very telling of the difference between the private care and the public care. And I think one of the things that I was hoping to hear more of from last night's speech, apart from what was anticipated was more restrictions and lockdowns and so forth, was that there would be more spending on equipment. So one of the things that Dr. Lockhart shared with me, Wayne, was that the oxygen, this oxygen mask or thing that she was getting, what she was using, this rigid, a tube that's going in your nose, but it's it was broad. It wasn't regular like the two-prong ones that you would see on like a cheap show or whatever. This was this thick thing in your nose, and going in your nostrils there. And she said to me, and I wonder if that was something similar to the same device, but she said to me that that was what was helping her get over this process of COVID. It was necessary for her, and it's still necessary for her to get through this process of COVID in the hospital. And she said in the PMH, there are 10 patients to a tent. And one of those devices is available for one tent. One device, one tent. But she can't go without hers being on her through the entire process. So that is the concerning thing for me, is that, of course, private care can have more, right? There's a cost to it. You can get more equipment. There can be where you, Wayne, can have one of those the same time as Doc has one of those. And you guys are, thank you, high flow oxygen. And I gather that's what it was. And I see my guest shadow minister Darville walking in studio now. But Do you see a difference? Do you believe that there's a difference? Did you feel as if there was a difference between your care, that you were being catered to, more so than what you probably have heard from your constituents who've had COVID?
I've not had a constituent who was hospitalized for COVID who had told me of their experience. My position on it is this, and it's just very simple. We have the Prime Minister. The last address he made that I read, he was bragging about us being back to revenue levels before Dorian. Well, man, you have money to do things with money, you know. You don't have money just to sit down and look at it. If you say you have a disease that's killing out your people, then surely the money you have is to put yourself in a position to give them treatment. It's just a crying shame that we are such a rich country in the world, and he seems content to sit down and wait until Martin Purse comes and then we beg a tent or two. The reason for the shutdowns and all of that was for him to increase facilities. I expected at this time, just as I was wheeled in for a CT scan at the beginning of my treatment, that should be happening to public patients. And if it isn't happening to public patients, him and his feckless Minister of Health should explain why it isn't. And I should expect that at the end of the treatment, I had a CT scan with contrast, that should be happening to people in the public domain, because in this country, you shouldn't die just because you don't have money. So these jokers who are around there talking about how much money they're getting, how much revenue they're getting, and at the same time are telling us that they're exposing us to begging to provide vital health systems, I find that completely unacceptable. The fact that I could pay for health care, that's fine, and I choose to do so because I could pay, I could alleviate the expense from the public health system. But it is not sufficient, it is not acceptable that people who are talking about all of this great revenue, read the last thing they ran on with Nahaja. For about 2 pages, they ran on with about the money they were making. You wouldn't think that it was about public health after they talking about all this money they were making. And then they're not paying the doctors, they're not paying the nurses. And from what you just told me, they're not providing public services to our brothers and sisters who cannot afford it. And they should be ashamed of themselves. They should be tarred and feathered.
Wayne Munroe, someone asked before I let you go, saying, are you making COVID political?
If you say to me that the fact is that the government has to provide a public service for people infected with COVID, then COVID is inherently political. The question is, what will we as a people feel satisfied with? Now, if we as a people are satisfied that Wayne Munroe could perhaps have some supporters who can help him pay a bill, or if he has health insurance, he should be able to live better in this COVID world than people who don't. And shame on everyone who thinks that has anything other to do than with politics. Because politics is how you use state resources to address state needs.
Wayne Munroe, QC, joining us. Wayne, it's a pleasure seeing you, buddy. It's glad to see you still got your fight in you. The engine isn't, still raring. The train is back on the tracks, or never left the tracks, but you're ready to go. And it's good to see that you're doing better and you're able to, get back to doing what you do. I mean, you say some strong words, man. Feckless minister. You had to say feckless.
They pay the people yet?
Well, that's a good point. No.
Right.
We're hiring new ones, man.
They're junior doctors who they fired.
No. Let me let you go. You're throwing too many blows. And you're from your recovery bed, you're throwing blows, Wayne. I mean, my God. Where is the peace in you, my brother?
I slapped it out over the last 5 days.
Wayne Munroe, QC. Get well soon. Take care of yourself, my friend.
Thank you, Nahaja.
All right. You're listening to the Hit Back with Nahaja Black. Listen, you thought he was done. You thought he was going to lay down. No, Wayne Munroe will not do that. You're listening to the Hit Back with Nahaja Black. When we come back, Shadow Minister of Health, Dr. Michael Darville, joining us on the show. We'll be back right after this.
Enjoy an elevated mobile experience with BTC, giving you
unlimited talk for the best conversations, unlimited data for all your online fun,
and unlimited roaming to stay connected while overseas.
For just $50 per line.
Unlock unlimited mobile talk, data, and roaming when you sign up for BTC Superfast Fiber Internet with speed starting at 100 megabits per second. Enjoy more great savings and value. Upgrade or sign up today. Visit any BTC store or btcbahamas.com. Conditions apply.
Rejuvenate, refresh, treat yourself. Immerse yourself in total comfort. Pamper yourself. After all, you're worth it. Relax. Rid yourself of all life's stresses. At Baja Retreat Anti-Aging Spa, you will find everything you need to enhance your body and spirit. Call today at 323-6711 and begin your journey to serenity at Baja Retreat Anti-Aging Spa.
It's the Hit Back with Nahaja Black. It's the Hit Back with Nahaja Black. It's the Hit Back with Nahaja Black. It's the Hit Back with Nahaja Black.
You're listening to the Guardian News Network. Good afternoon, everyone. I'm Taylor Ferguson. Here's what's making news. Thank you so much for tuning in. The Bahamas will receive 40,000 doses of the Johnson & Johnson vaccine by the end of August. Today, Health Minister Renward Wells told reporters that supply is coming through a Caribbean and African partnership.
We have collectively pooled our resources, and the Bahamas right now is entitled to about 40,000 doses of Johnson & Johnson. We put down our down payment for it, and we're expecting probably by no later than the end of August.
Prime Minister Dr. Hubert Minnis giving notice in Parliament today that government is seeking to extend the state of emergency to November 13th. During a national address last night, the Prime Minister said government would seek one final approval from Parliament to extend the state of emergency in the country. Parliamentarians expected to debate that resolution tomorrow. Also, Dr. Minnis introducing a bill for an act to prevent and manage a public health emergency in the Bahamas. Attorney General Carl Bethel said the bill tabled today is intended to create a framework under the Constitution, as opposed to emergency powers to allow government to better manage the pandemic.
So long as any order is an order that is reasonably justifiable in a democratic society. That is the standard in the Constitution. It must be justifiable in a democratic society. And of late, that phrase has been summed up in the word proportionate. It must be proportionate to the threat posed.
The face of the late Arthur Dion Hanna will replace that of Queen Elizabeth on the Bahamian $100 bill. In paying tribute to the former Governor General and Deputy Prime Minister in the House of Assembly this morning, the Prime Minister announced the new bill would be commissioned.
Arthur Dion Hanna fought for equality and social justice throughout his long life. He was a champion of the poor, the vulnerable, and the downtrodden.
Parliamentarians observed a moment of silence for Hanna, who died at his home last week. And that's what's making news. I'm Taylor Ferguson. AP News is coming up next.
Coronavirus update. I'm Tim McGuire with an AP News Minute. The Delta variant fueled surge in COVID-19 cases, especially in states and areas with low vaccination rates, has President Biden wondering how to reach those who refuse to be vaccinated.
I continue to hope that people will overcome their fears
The Washington, D.C. government ordering its workers to be vaccinated. In South Florida, critical care nurse practitioner Kevin Cho Tippett says they're being hit by huge numbers of cases.
600% increase in people suffering from the virus in our hospitals. We had less than 90 just last month. We now have over 600.
Florida, Arkansas, and Louisiana all have their most COVID-19 hospitalizations of the pandemic. Hospitals are short-staffed, beds are full. A man with a heart attack was bounced by 6 New Orleans hospitals before finding an emergency room. I'm Tim McGuire.
This is Guardian Radio 96.9 FM, Nassau, Bahamas.
It's the hit back with the hash of black. It's the hit back with the hash of black. It's the hit back with the hash of black. It's the hit back with the hash of black.
And we're back. You're listening to the Hit Back with Nahaja Black, Guardian Radio 96.9 FM. Joining me in studio right now, everyone, first time guest of the show. I've never had the luxury of having him on the show. Former member of parliament, present senator and shadow minister, now senator and shadow minister of health, Dr. Michael Darville. Dr. Darville, thank you so much for joining the show.
Thank you so much, and good afternoon, Bahamas.
It's a pleasure to have you on. First time invite and guest. So thank you so much for saying yes. Always a pleasure to have guests on the show. So, Doc, it's an interesting time for us to be meeting, eh?
Well, listen here. I've been listening to your show, and I'm very impressed with the work you're doing, and it's a pleasure to be here today.
Thank you. Oh, that's good, man. Listen, did we pay? did we do any sort of flowers or anything for Dr. Darville? That was nice. Thank you. So, I mean, it's interesting though that this is the time that we meet, right? That we are in the middle of a health crisis, a national or global health crisis, the pandemic that's before us, and where we as a country are sitting in a space now where we are looking for solutions. We want answers. We want to know, how do we move this train forward? Last night, the Prime Minister, as the Shadow Minister of Health, of course, you've made statements with regard to how this process of COVID-19 is being handled, how you believe that it can best be approached. And we'll get into the question of, has the party itself felt as if you've been tried to put your stake in it, your paw print on this pandemic as best as you can, with seeking to be more involved, etc. So we'll get into that. But with this process right now, when you heard the speech last night, and I wanted to go there first. Last night's speech, last week, Wednesday's speech, I think it was last Wednesday's speech as well. What did you hear that you liked in last night's speech? And what were you expecting to hear that wasn't in there from a health perspective?
Well, first of all, we've been listening very closely to the Prime Minister, what he says to the Bahamian people, what are the plans for the Free National Movement going forward with the crisis. Mm-hmm. And if we were to go to the speech before the speech that we heard on Monday, we were anticipating in the midst of the crisis that the Prime Minister would have activated some new protocols. Instead, none was done. And so when we listened to him today, on Monday, we realized that the situation may be more intense than what we are getting from the Ministry of Health itself. We believe that the COVID situation is a bit worse than is being reported. We believe that many of the individuals who want to be tested could not have access to testing. And as a result of that, we are finding cases of individuals who are asymptomatic, who are untested and who are positive. And so when we look at what the government is doing as far as testing is concerned, our first concern is that it needs to be ramped up. We need to find those asymptomatic carriers. We need to know where they are. We need to isolate or quarantine them and move them from the general population so we can have a lower person-to-person spread. And so we will listen very carefully to what the Prime Minister have to say. He didn't say much about that, but I anticipate that the Minister of Health in his contribution tomorrow will go into more details of what the government plan is as it stands right now to reduce the person-to-person transmission.
I think that's a hopeful.
Well, we're hopeful
thought
that
there.
they're listening, and all the technical experts that are affiliated with our organization and our COVID task force, waiting patiently to find out what are some of these new protocols that the Prime Minister and the Minister of Health will be implementing in order to get this high level of cases and reduce person-to-person spread.
You know, testing is an interesting one because I think from the beginning of this pandemic, and if you just tuning in, Dr. Michael Darville joining as Shadow Minister of Health for the Progressive Liberal Party, official opposition of the House of Assembly. At the beginning of this pandemic, we were all, I think the whole country shouting the same thing, free testing. And we're still saying, listen, can we get more testing, make it more robust? But we've heard the chief medical officer saying that's not necessary. We've heard others say, maybe that's not necessary at this point. You know, that's not what you need to do. Even Dr. Sands at one point said similar, that that might not be necessary. Now, Dr. Nakia Forbes has always said we need to do more testing. And that is something that's a mantra. Why do you believe that it hasn't happened? Do you think it's a direct reflection of cost? Is there some study, some reasoning behind why some physicians say yes and others say no?
Well, when we look at the science, most of the individuals who are involved in the epidemiology will say yes. Dr. Nakira Forbes, who is our expert in infectious diseases, have said yes.
Mm-hmm.
The reason why the answer is yes is because we know with the pathogenesis of the illness, individuals who are exposed, only a small fraction become symptomatic, and that symptomatic system is between moderate to severe.
Mm-hmm.
And so if an individual have mild symptoms, they are not motivated to be testing, particularly if they have to pick up the cost. That puts the whole contact tracing and the whole system of removing asymptomatic individuals from the community and to quarantine and isolate in a different scenario. And so when you look at the science, testing is absolutely necessary because the disease or the virus is invisible. The only way it's going to show its face if we go behind and try to find those individuals who are. Now, in the PLP 10-point plan, we speak about testing, but we speak about testing as it relates to individuals who have been exposed or those who have a high motivation to be tested. It doesn't speak about going and forcing testing on the general population. There are individuals who have been exposed who would like to be tested but don't have the resources to do so. And under the current policy, individuals who have been exposed and who are symptomatic have access to free testing from the Ministry of Health. We believe that this needs to be expanded. And in order to expand it, we need to put centers around the country, not only in New Providence or Grand Bahama, but even some of our family islands with a high influx of tourism in our community. We need to beef it up. I don't know if you remember, you saw a video a couple months ago of tourists at a clinic in Exuma.
A couple weeks ago.
And it went viral.
Mm-hmm.
It's a clear indication that we need to do more. And the government need to add this arsenal or this particular policing mechanism to its present protocols.
If you were looking at it and looking at it as one of the points in your 10-point, and I would like us to go through this 10-point program, and I think the reason why I would like to hear it personally out loud is because we're looking at alternatives, right? We're looking at different ways we can get this process done. And the Prime Minister last night said, listen, we want as many persons now as we looking into this emergency preparedness and management bill to give us some help. right? They're now opening it up and saying we want to get into the community and get advice. And there's this argument that that hasn't been the case necessarily with the handling of COVID-19. And wanting to get a sense from you, Dr. Darville, your 10-point process, right? Testing being number one.
It's definitely one of the most important factors of our plan. Yes.
How do you look at, because now we're in a place where we're in a third wave, right? This
Yes.
third wave, by all accounts, and Dr. Dwayne Sands was on the show yesterday, and his accounting is that it is worse than they've seen by and large due to the loss of staff, right? With shortfall in staffing. That was what he's, saying that is the measure. Whereas I say record numbers of 200 and some odd cases a day is definitely an astronomical number. How would the Progressive Liberal Party handle this issue of staffing at the same time we're looking at this process of COVID-19? Because this is a challenge that this government is facing.
There's no questioning. We have been saying it all along that the infrastructure at our tertiary facilities are not up to par to deal with what we are facing today. We've had the opportunity in phase one or wave, the first wave, to be able to initiate some draconian measures where we actually lock the country down to prepare our healthcare services for what is about to come.
Yes.
We know, and from the science, we understand that there would be first, second, third, and possibly fourth and fifth waves because COVID-19 is going to be with us for a long time. It is important that the government come to the realization that we must be proactive rather than reactive when we fall into these waves. The time has come for us to take a very close look at our medical infrastructure, expand on it immediately. Now, the Prime Minister alluded to the expansion of the COVID ability in the surgical ward and so forth in the third wave. This was supposed to be done in the first wave. And so we said, get our medical infrastructure in order. Add an additional wing if you possibly can. Do you remember in the heat of the pandemic in China, they constructed a complete hospital?
Two.
Exactly.
Yep.
And so we had ample time to create additional wings. Thank God for Samaritan Person. Thank God for the tent city. But the reality is, I believe that we had the opportunities, and I think that we were not aggressive enough to put the necessary infrastructure in place. The second thing is, in the middle of the COVID, we spoke specifically to the government. You realize that there's a PLP task force. The TLP task force is not to be in competition with the Ministry of Health task force. The PLP task force was put together with medical professionals as well as advice from epidemiologists to guide our leadership in the creation of policies because we see ourselves as the government to be. And we realize that on day one, should the Lord bless us with the victory, we will be able, or we will have to address this issue from day one. And we've come up with our 10-point plan on how we intend to do it. And we have been advocating, if you go back in the literature, you will see where our task force has been advocating for expansion of our healthcare infrastructure to the point of establishing an infectious disease wing at the Princess Margaret Hospital as well as the Rand Memorial Hospital, because we understand how this infection works, and it will be with us for a long time.
And that's important because, of course, this thing is going to be with us for a long time. How do we manage it, address it, and protect the economy as well? So Dr. Michael Darville joining us on the show, Shadow Minister of Health. Then I have to ask this question because I want us to get into the 10-point program at this point, very shortly after this question here. There's an argument going around, and the last night's speech, the Prime Minister intimated that we cannot continue to politicize COVID-19. Do you believe that the Progressive Liberal Party is making it difficult for the Prime Minister to do his work by politicizing COVID?
No, we have said from day one that COVID should not be a political argument. We believe that in terms of these type of healthcare crisis, there should be a bipartisan approach to handling the situation. We've always said that the Progressive Liberal Party have been reaching out to this administration to say, listen here, you have some expertise. We have some expertise. The time has come for us to join forces with our expertise. Let us not politicize this issue and let us take a bipartisan approach on handling this issue. We've made that clear in the public domain. Immediately after, the Prime Minister said that he would not take advice from our leader. And so he made it a political issue from day one. The reality is that this is too big for one government. It requires the involvement of the people. It requires the involvement of all political organizations to come together to fight this deadly disease that are taking too many lives unnecessarily. If you follow what we have been doing, we have only been advocating for improvements. We cannot allow a government who have decided to make it partisan to just come with ideas. It is important for us to say no. We believe that this is also important and you should take it into consideration. Now, we have been sending information to the government task force, and it's up to them to either accept or reject our recommendations. Some have been accepted, some have been rejected. But today, even with every press statement or release that is done by the Progressive Liberal Party, we say we stand ready to assist the government in their fight against COVID-19. But while we wait, it is essential for us to make recommendations, particularly when we think things are not going the right way.
Let's go there. Things not going the right way. What would you say are some of the top glaring issues or missteps that you believe that the government has made with regard to this pandemic?
Well, the first thing is the government itself, I believe, did not capitalize on some of the key lockdowns that took place in the country. The purpose of lockdowns is to stop person-to-person interaction. Mm-hmm. If you stop person-to-person interaction, the virus need a host, and the host is a human being. And so if we stop interacting and we stop coming together, there's no way for the virus to spread. And so you begin to see flattening of the curves. The purpose of the flattening of the curves is to ensure that the government now take the next step to prepare for what is to come when we come back together. Because the minute as we come back together, there's interaction. So we have to host. Yeah. And so the virus will spread again. And this is the challenge that we believe that is going on. The government is being reactive rather than proactive. This is our third wave. The science has already told us that there would be mutations. The mutations will be more contagious and some of them will be more virulent, which means that individuals who are not vaccinated are exposed and they have the opportunity to go into the full-blown COVID. I know. I was a victim of COVID. I survived, thank God. And I realized coming here that you were speaking to Wayne Munroe. Thank God. That is my colleague. We've all been praying for him. And thank God he's at home, recuperating and doing well. Not everyone can say that.
That's right. 308 people
exactly.
Can't say that.
Exactly.
So then, okay, that's a misstep. And I agree with you that, hey, that we're very much reactive. We're not ahead of this as a process. And something that you said that rang true is that the purpose of the pandemic was to prepare. And we heard another pandemic, the lockdowns was to prepare. We heard this said earlier, right? When we were talking about flattening the curve, and that whole conversation has stopped. Mm-hmm. There's no more discussion of flattening the curve. So I don't foresee any more lockdowns. That's a done deal. Do you believe that that is a mistake at this point? Or do you agree with the Prime Minister's position of we're going to have to just tighten the noose a bit and put some more time constraints on us? What do you think of that?
Well, the science is clear. When we look at the Harvard Review, when we look at WHO, the science indicates that when you reach to the numbers that we are today, we have to initiate some protocols to prevent person-to-person interaction. Mm-hmm. The Progressive Liberal Party do not really support lockdowns because of the devastating effects to our economy. But we believe that there are other tools that can be used effectively and aggressively in order to stop the person-to-person interaction. And to also to be able to identify those asymptomatic carriers in our community. We believe testing will play a dynamic role in finding these individuals. And when we find them, we must be sure that we have the necessary isolation and quarantine facilities to move them. One of the things, Ms. Black, that we found was that, particularly on our family islands, many are experiencing difficult times. Many are clustered in one environment. You got an individuals who are positive. You send them home to isolate in a one-room house. Come on. It is important for us to put some facilities or have some facilities available and have the necessary public health individuals to identify those individuals who are at risk, particularly families clustered in one small environment, to remove them from that environment and to allow them to go through their quarantine and isolation protocols away from the family in that situation. So a lot of things need to be done. One, we must boost up our testing. Two, we must increase our contact tracing. We have a 24-hour window in order to be able to identify individuals before we have exponential spread. And so the time is not on our side. We need to ramp up our contact tracing team as a reflection with the amount of cases that are presently showing up in the country.
I'm glad you said that, because I was going to ask, what data do we have to know how many people should be, how many contact tracers should we have based on the population or the amount of persons that are positive? Again, Dr. Sands, being on the show yesterday, shared a model that showed the probability or the reality that we may exist in is that if we're seeing 200 people positive, 200 plus people, the models say that it's more likely about 600 to between 600 and 800 people actually positive in that day, right? So how do we know how many contact traces do we need to fight this?
Well, the model is clearly outlined in a model that was put together from universities in Wuhan, where the infection originated from. We believe that as it stands right now, with the amount of individuals that are positive in our country and the possibility that it may be 3 times that amount, we understand that we should have nowhere less than 250 to 400 contact tracers to be able to handle a situation of this magnitude. I can say this much. I had COVID. I went to doctor's hospital. It was confirmed. I was placed in treatment. I was isolated. And it took a couple of days before individuals that I have come in contact with were contacted. The cat was already out of the bag. And if it was a situation whereby there was spread, we would have had more spread than if we were able to get to the situation immediately within the first 24 hours, because that's our window of opportunity. When we diagnose the first 24 hours, we must be able to have the model organized and those individuals who have been exposed to be quarantined or isolated pending on the result of the PCR test.
Dr. Michael Darville joining us, Shadow Minister of Health for the Progressive Liberal Party. Let's talk about cost. One of the things that folks can say, well, listen, it sounds good, but we are also in an economic struggle. If the Progressive Liberal Party was to win today, right? No elections happening today, but if there was an election called and you guys were to happen to win, that would be the honor bestowed on you by the people of the Bahamas. What and how would you be able to do these things that you've mentioned? A facility. What have you guys seen a facility that you're thinking of using? What sort of costs are we looking at? Are we talking about multiple facilities? Are we building out facilities? What is that goalpost or strategic plan in order to get these things done in terms of with our cost limitations?
Well, you're right. Everything comes with a cost. Public health issues and issues as it relates to COVID-19 and infection and death and our hospitals bursting from the seams. We believe that the costs to test individuals, particularly those who have been exposed, those who are definitely in need of immediate travel, those individuals who have a strong belief that they may be positive, we believe that the government must absorb that cost. Because when you look at the effects of those individuals who may be positive in our community and the effects it will have on our public healthcare system, the reality is the cost for this test, we believe, will be far less than the ramifications as a result of individuals exposing other individuals and causing an excessive healthcare crisis in our country. The second thing about it is that health is paramount. We're losing too many lives. I think one life lost is too many. It is important for us to identify through public health measures those individuals who are positive, who need isolation and do not have those critical symptoms to overload our hospital, to be able to go into a secondary or step-down facility where they can get the necessary care without exposing their relative families.
Mm-hmm.
That cost must be absorbed, and we must be able to do it. Because if we do not get the infection under control, it will affect our bottom line. It will definitely affect our economic recovery and the opening up of our economy, which is essential in order for us to begin to pick up the pieces and get Bahamians back to work. I believe, and the Progressive Liberal Party believes, testing for individuals who have been exposed and finding facilities that presently exist where individuals need to be isolated or quarantined will be far less than the burden that we will feel if this infection run rampant in our country and we're not able to get it under control. So the economic investment will pay off in the long run with a quicker opening of our economy and economic recovery.
Do you believe that that is a viable option or alternative for those who wish not to get vaccinated? Because, of course, Bahamians, and we're very strong on this. Bahamians are very strong on this. They're very much vaccine hesitant. Wayne Munroe said himself, if there's no, guarantee even from the government that this thing is safe in terms of, insurance or whatnot, why should the citizens be told to take it? And I agree with him on that. If there's no backing for it, is that something that if the masses continue, if we're still at 25 to 30% vaccinated, we're far from herd immunity. Variants will still show up in the world and in our country. Is that something that the Progressive Liberal Party sees as a viable alternative or option to jumpstarting or keeping the economy safe whilst folks are not vaccinated in mass?
Well, I want to reiterate the Progressive Liberal Party as it relates to vaccination. We have studied the science, took COVID task force along with consultant epidemiologists and scientists. We are of the view, like the government, that vaccination, the benefit far outweigh the potential risk. With that being said, we believe that vaccinations should be voluntary, particularly when all vaccines and the four major vaccines that exist, which is Pfizer, Moderna, Johnson & Johnson, and AstraZeneca, have only been given by the FDA and other organizations for emergency use. Mm-hmm. We realize that most of these companies have already applied for permanent or for full FDA approval. And until that happens, vaccination should be voluntary. And as you can see around the world, that is the position, because it's very difficult to speak about forcing people to be vaccinated when the vaccine itself has only been approved for emergency use. Mm-hmm. Now, with that being said, if we study the medical journals and we look at the scientific literature, it is clear that those individuals who are vaccinated, particularly with the first two doses, they are able to fend or fight better if they are exposed to these new variants of COVID-19.
Mm-hmm. So then the suggestion of testing and quarantining with the facilities that you guys envision, that would be the best alternative then? Because that's what I want to find out from you. Are you guys viewing that if the masses continue to still, wish not to be vaccinated? Again, everyone's choice to do so, no judgment there. That will help us move forward, because if we don't get vaccinated, can we move forward?
We will have to move forward.
Yeah. And is that
but
the
it is important?
strategy?
Yeah, it is important for the government to don't become tunnel vision and only look at the vaccine, which is only one mechanism or way to really fight the pandemic. We need an arsenal in our toolbox. 1, free testing. 2, isolation and quarantine. 3, the use of more advanced medical protocols and medical drugs when people do become infected. 4, expansion of our healthcare infectious disease wing to be able to handle it. Figure out how we're going to interface our hospital with the infection so that our healthcare, current healthcare systems are not affected to the point where everything is focused on COVID. People have to take care of their
That's
healthcare.
right.
I can tell you this much. In Grand Bahama, there's a lot of individuals with chronic non-communicable diseases who are afraid to go to the clinic, who are afraid to go to the hospital because of the exposure of COVID. And if we look at the data, there's an increased morbidity and mortality as a direct result of clinics being postponed, individuals refusing to go to the clinic. So our medical infrastructure for other forms of illnesses is suffering because of COVID-19. The time has come for us to begin to do the necessary expansion, not necessary closing off certain wings. That is a short-term approach. There has to be a short-term, medium-term, and long-term. We believe in the PLP. We have those plans in place, and we believe that we have the ability to activate them should the Lord bless us with the next victory in the next general election.
Grab your headphones there, Dr. Darville. Okay, good. We'll take a quick break. When we come back, we'll have the phone lines open in the last 15 minutes of the show. So round about 5:45, maybe 5:50, we'll start opening the lines. Dr. Michael Darville joining us on the show. You're listening to the Hit Back with Nahaja Black, Guardian Radio. We'll be back after this.
Tired of banks forcing you to use technology to bank the way they want you to? Your convenience is important. So no matter what your banking needs, Commonwealth Bank's friendly staff are always available in branch for that personal one-on-one service. But when you choose technology, our online and mobile banking app offers you state-of-the-art functionality. The choice is yours. Commonwealth Bank. Bank the way you want.
When I had got prostate cancer, my family didn't know if I was going to live. At Cancer Treatment Centers of America. Within days, I got an appointment. They presented me with treatment options, and we set up a robotic prostatectomy. When my scans came back, there are no signs of cancer. They don't see you as a number, they see you as a part of the family. I'm going on with my life. That's a real gift.
Call us at Cancer Treatment Centers of America.
Enjoy an elevated mobile experience with BTC, giving you
unlimited talk for the best conversations, unlimited data for all your online fun,
and unlimited roaming to stay connected while overseas.
For just $50 per line.
Unlock unlimited mobile talk, data, and roaming when you sign up for BTC Superfast Fiber Internet with speed starting at 100 megabits per second. Enjoy more great savings and value. Upgrade or sign up today. Visit any BTC store or btcbahamas.com. Conditions apply.
It's the Hit Back with Nahaja Black. It's the Hit Back with Nahaja Black. It's the Hit Back with Nahaja Black. It's the Hit Back with Nahaja Black.
We're back. You're listening to the Hit Back with Nahaja Black, Guardian Radio 96.9 FM. We've got Dr. Michael Darville joining us, Shadow Minister of Health for the Progressive Liberal Party, joining us on the show. If you've missed any part of the show, you've missed an interesting one we had earlier. Wayne Munroe, QC, talking about his experience. Wayne, though sounding not so great, made it seem as if he went in the hospital by mistake. I just don't know.
Wrongly diagnosed.
You know, that's how we carried on. Wayne carried on like, well, I mean, I just was tired, and all of a sudden my wife called the doctor for no reason. Come on, Wayne. You know, nobody gets in the hospital because they were tired. Wife panicked. Yeah. So we were like, someone says, and I wanted to get to some of these comments here, and we have some text messages as well. Dr. Darville is pretty strategic in their approach defending managing this virus and the variants. He clearly understands what is happening and presents a plan. Let's get to some of these here. That we should be happy that a doctor's in charge. Someone says that we should be happy that a doctor's in charge. Why should the people be happy and confident with all of these missteps? From Grand Bahama, we are listening. And I guess that's the concern with a doctor in charge. Should we have had a different outcome for this pandemic? Or is it just that it's over? Because that's the argument, you know, Dr. Darville.
I know it's the argument. I think it's a flawed argument because
that the world is struggling?
No, when we look around the world and we look at leaders around the world who are doing a relatively good job with the pandemic, a lot of them are not clinicians. The secret with this whole thing is the fact to have the right people around you and have the necessary technical experts who can assist you in making sound public health decisions. And when you get the decisions, you adhere to decisions and don't make the decisions on your own, because you must definitely be able to assess the science and to be able to bring the right balance that fits your country. And we have many countries around the world where leaders who are not physicians are doing an excellent job with the pandemic.
Let me ask you this. One of the things that I've said is that we are now at a point, all of the challenges, all of the missteps that I believe that the competent authority has made, all of that taken under consideration. We're now at a point where we're looking at 200, positive cases in one day, 7 deaths. I think it was 7 or 9 deaths in one day, 3 the other. We're looking at younger persons finding themselves now on that death toll. Families, clusters, events, all of these things are happening now. And at some point, triggers should be pulled, right? Triggers should be pulled. One of the things that now I find that the competent authority, the Prime Minister, all the Ministry of Health officials are in is a space called damned if you do, damned if you don't.
Yes.
Right? Where if they were to tighten reins, and I noticed today, I think what is a concerted effort is to show that Jamaica is doing more, even tighter restrictions than the Prime Minister. Prime Minister Holness is doing tighter restrictions than Prime Minister Minnis. That I think I see as a sort of thing being played out in politics here. That is the Progressive Liberal Party feeling any form of sympathy for this administration at this point? Because if the Prime Minister was to lock us down, it would be for the health of the people, but not for the wealth of the people. Is there a balanced approach that the Prime Minister right now, the competent authority, all of the government can do, that the Progressive Liberal Party sees that can help in a balanced approach of protecting the economy as best as you can, while at the same time not forsaking or, giving up on the lives of Bahamians in this pandemic? Is there a balanced approach that the Progressive Liberal Party would offer?
Yes, there has to be a balance, and we have been speaking about it from the beginning of the pandemic. And someone summed it up very good to me. Yes, our health is at risk, but we are hungry.
Mm-hmm.
Should we die from the virus or should we die from hunger?
That's right.
And these are the realities that we're facing in the community. We believe that by instituting new protocols without reverting back to the draconian measures will help to reduce our person-to-person transmission, and as a result, begin to see the flattening of the curve. We believe that we need to go out there more aggressively, find the asymptomatic carriers. The virus is invisible. The only way we can find them is by testing individuals who we suspect are or have been exposed to the virus. Isolate them or quarantine them in a safe manner, ensure that they adhere to the regulations so that the effectiveness of the virus over a period of time will subsequently burn itself out, and that individual will not be able to spread in the community. The second thing I think we need to do is we need to be accountable and transparent about where the clusters of infections are. That is important to us because that is no longer an issue. We do not get that information in the briefings anymore. Before we did.
Mm-hmm.
That is important. Because if we have a cluster of infection at position A, a lot of Bahamians will opt not to go in that particular area in order to protect themselves and to ensure they protect their families. Yes, the protocols, mask wearing, social distancing, and sanitizing are very important. But by knowing where the clusters are, we are able now to avoid those areas so that the public health officials can move swiftly in the area along with the necessary contact tracers to begin to bring resolution to the cluster and prevent person-to-person spread. So I believe we can be more aggressive in those areas. We are of the view that another lockdown will be so devastating to our economy. We believe some errors were made in terms of opening up for the second wave, particularly with home porting. That's water under the bridge. You asked me a specific question, or what can we do rather than instituting these draconian measures? I agree that testing of individuals who have been vaccinated coming into the country is absolutely necessary. We know the science. The science is clear that individuals who are vaccinated could still spread COVID-19, particularly the Delta variant. They are usually, and most of the times, asymptomatic. They come into an environment where, like you have said, only a small portion of our population is vaccinated. The science is clear. Individuals who are vaccinated versus individuals who are not vaccinated tend to do better in fighting the deadly or the complications of the illness. And so it's important to know where the clusters. That's one thing. So I'm asking the government and I'm challenging the government that when they bring a public health issue, please notify us where the clusters are. Notify us where the clusters are. And I challenge them to beef up their contact tracing, beef up their surveillance unit to be able to move in on that cluster and also to be able to find those areas where people are congregating in large amount, moving quickly and disperse those individuals.
I have so many questions. We got to take this call real quick. Let's take this call. Caller, you're on the air.
No, Joe, and good afternoon, Dr. Darville. How are you doing?
Very well, sir.
Thank you.
Excellent. Doctor, I'm very proud of you. Before I make my contribution, I'm very proud of you, sir. You sound like the Minister of Health. You sound like the Prime Minister, as a matter of fact. To get into it quickly, Nahaja, the question isn't and should never rise with life and health of affordability and finances. No cost should be spared to protect health, preserve life, and support the Bahamian community to protect and preserve our homes, businesses, and jobs. Because even after this medical pandemic is defeated, we have many Bahamians for varying reasons who will be at varying positions in their life, including old age, who will not be afforded that second, third, or fourth opportunity to get their home back or to restart their business. Finally, Naja, can you hear me clearly?
Yeah, yes, I can.
Okay, I'm just trying to go quickly. The best approach to protecting the population in conjunction with bolstering the healthcare plan, as Dr. Darville identified, with equipment and human resources, is a proper and comprehensive public education policy, which will lead to an even greater degree of personal responsibility. Personal responsibility factor is what will be the largest and the longest and most effective public response to keeping Bahamians safe from developing a severe COVID-19 infection or loss of life at the end of the day. And we cannot determine that Bahamians have COVID-19 vaccination hesitation if just because they are asking questions about an emergency approved drug, and especially where we don't have the amount of vaccines necessary to populate the entire country and then see if they continue to move or not.
Yeah.
Thank you for the opportunity.
Thank you so much.
Thank you so much. And you have so much. The question is so loaded, but I'm going to attempt to answer a few of the areas. When you speak about vaccination hesitancy, we're seeing it as a phenomenon around the world. The Progressive Liberal Party believes that through public education, using healthcare professionals who are able to decipher the medical literature and speak specifically to the science, we believe through public education, we will be able to do a better job with vaccination hesitancy. And we do agree that one Bahamian loss as a result of COVID-19 is too many. Our paramount focus should be on the lives of the Bahamian. We can find money to do a lot of things. Why can't we find the money for a Bahamian who want to be tested for COVID-19 and don't have the money to be tested? We know that the facility is presently in place, but that facility is only in place if the individuals are symptomatic. We know from the science that the majority of people who are exposed to COVID-19 are asymptomatic, and they can be the vector that will go home and infect other members of their family who subsequently will not be able to mount the necessary immune response or would not have access to the new sophisticated drugs, and as a result, may not survive as a result of it. And so we believe that cost is a factor, but it should not be in the way for the health and well-being of Bahamian people.
And, for the record, Dr. Michael Darville joining us, one of the things, Dr. Darville, I think I can hear a lot of people saying is that it all sounds good when you're in opposition, though. Does the Progressive Liberal Party on day one, and you've said, yes, we have a plan, but you're taking into account the debt that we're in. Does the plan take into account whatever economic levels we're in? Is the plan taking into account if you walk in day one? As the former administration said, the cupboard was bare. The one before that, when they came in, everybody's always broke when we walk in the first term. But this will be a crisis. If it's not resolved by next election, this will still be before us and COVID will still be here. How certain is the Progressive Liberal Party that if they get in, we can get these facilities, that you will spare no expense in getting the intubation or the ventilators and the high flow oxygen equipment? And how confident does the Progressive Liberal Party feel that we can acquire facilities? At what cost will this happen? And mind you, there should be no cost for lives. But how confident are we with these projections or what you're hoping to happen?
Ms. Black, we are very confident. After the Progressive Liberal Party's platform burned to ashes in the last general election, we had to look internally to find out what is necessary for our organization in order for us to present ourselves back to the Bahamian people. We have realized that one of the reasons for our loss in the last general election was the fact that we disconnect with the electorate. They lost focus of us. We were so busy trying to figure out what we needed to do that we forgot the purpose for us to be elected. You can rest assured. Under a Davis-Cooper administration, every member of parliament in the Progressive Liberal Party will have to spend a substantial amount of time in his constituency dealing with real issues that affect the Bahamian people. I can tell you, one of the things that we intend to do within the first 100 days is to address this crisis, find the resources through conventional means, infrastructural developments through private-public partnerships, where the government does not necessarily have to take on the burden initially, create facilities that are turnkey, and the government will be able to pay for these facilities over a period of time, expand on medical infrastructure that have been delinquent for years, and to be able to create the necessary manpower resources in our country to take our healthcare system from where it is today to a modern healthcare system. It has been done in many countries, even in more difficult situations.
Let's take this caller real quick. Caller, you're on the hit back. Welcome.
Yes, good afternoon, Dr. Darville. Two quick questions. On the coming into office of the Davis and the gentleman in I'm talking about Mr. Cooper. There is a health clinic there that is incomplete, right?
Where is this, sir?
That's in Exuma.
Yes.
And there is another incomplete clinic in San Salvador.
Yes.
And another one in Cat Island.
Yes.
I would just like to know if as ministers of health, if they would be your first priorities in completing them so that we can solve this problem here in Nassau, in our hospitals. Would that be a part of your policies, or would you find some other place to put those COVID-19 patients?
Yes.
Because go ahead.
Sorry, no, if you didn't finish, continue, sir.
Yeah, quickly for me. Yes, thank you.
The next question is, as a doctor, we've got a doctor in charge now as Prime Minister and the covered authority. as a doctor, do you empathize with him? How would you handle this problem? I'll hang up and listen.
Thank you so far. Thank you so much. You've said two questions. You speak specifically about clinics in Exuma, Cat Island, and San Salvador. I want to let you know that under the former administration, I, along with a team from KPMG, was given the task for medical infrastructure, particularly in the Family Islands, where we have 90 plus clinics. Out of the 90 plus clinics, 23 clinics were earmarked for improvement prior to our launch of national health insurance. The clinics you speak to are in San Salvador. You speak to clinics in Cat Island. There was some involvement of clinics in Samani Luthra, and the list goes on and on. We launched national health insurance, understanding clearly that in order to create equity in the system and to be able to reflect the quality of healthcare that individuals have in New Providence and Grand Bahama, we would need the necessary upgrades. Those upgrades are absolutely essential when we speak about COVID-19 and the infectious disease component associated with it. When we formed the COVID-19 task force, as an advisory to our leadership, we met with the government and we spoke specifically about whether they were ready in order to upgrade those clinics to handle cases of COVID and to be able to quarantine individuals who may become positive or who have been exposed. The answer to those questions at the time was yes. The government indicated that they were ready for the pandemic and these things were in place. We learned subsequently that they are not in place. And once again, we call on the government to ensure that every family island have in place the necessary protocols along with the isolation facilities to deal with these cases associated with COVID-19. The second question you ask, as a medical doctor, what would I have done differently if I was in the position? The first thing I would have done was never to make COVID-19 a partisan issue. I would have reached out to the leader of the opposition, and I would have made COVID-19 a non-political issue, just as we have agreed to make the financial services sector non-political. So when bills come in from the financial services sector that protects that part of our economy, we get together and we find the best solutions for it. Why is it that for the last year and a half, the Progressive Liberal Party has been reaching out to the competent authority to say, we are ready to assist. Trust me, we have some expertise in our organizations that can help.
Well, and I think we've seen that. We know that you guys have an epidemiologist as a part of the task force that you have. Let me ask this before we go, though, because I have tons of questions on some of the comments that you made, but time is of the essence, so I can't even rebut certain things because of time. Here we are now, three big things that you will say, ideas that you would give the government now. We're not waiting for election. The Bahamian people need help now. That you would say, apart from testing, apart from quarantining, what other suggestions would you give this government now? We have 30 seconds.
Well, thanks of all. Well, the first thing is we have a 10-point plan. We spoke specifically to 2 or 3 of the elements of the 10-point plan. One thing that I like to talk about is the COVAX facility, and the government, as it stands today, have only acquired 20% of what is needed for the country. The time has come to reach out to the private sector. The private sector has been in the procurement process for drugs from time immemorial. The time has come for the government to reach out to the private sector to assist, just as we indicated in the initial stages of the pandemic, that the testing lab should be decentralized and allow private sector be involved. Do you realize, because of the private sector, we are able now to better police the infectious nature of the disease in our community? The same thing with the drugs. The next thing that I want to talk about.
Yeah. We can do this again. We're going to do a part 2.
Thank you so much. It's a pleasure being here.
Dr. Michael Darville joining us on the show. We'll do another part 2. We'll see you guys tomorrow. You're listening to The Hit Back with Nahaja Black.
You're listening to the Guardian News Network. I'm Taylor Ferguson. Here is your evening report. It is Tuesday, August 10th, 2021. Thank you so much for tuning in. Prime Minister Dr. Hubert Minnis tabling a resolution to extend the state of emergency until November 13th. Also tabled the long-awaited Public Health Emergency Preparedness and Management Bill. Attorney General Carl Bethel telling reporters today the bill will provide the legislative framework to manage the public health emergency once the state of emergency expires in November.